I do a general patient assessment on a trauma patient. My partner will read off the scenario and then we'll get right into the assessment.
22-year-old male patient struck with a baseball bat.
Okay, as I arrive on scene, I'm going to scene safety BSI for my partner and I.
The scene is safe.
How many patients do I have?
One patient.
Okay, the mechanism was a baseball bat, and additional resources, I'm going to call police, fire, whatever I need to process the scene. As we walk up, because this is a trauma patient, I'm going to have my partner maintain C-spine. At that point, I'm going to come up. Sir, can you open your eyes? Can you talk to me?
Patient opens his eyes.
So we have verbal stimulus. At that point, I'll then use a jaw thrust, lift it up and push it down to open the airway. I look inside. What do I see?
Airway is open and clear.
So the airway is clear. At this point, I'm going to go ahead and measure and insert an OPA. I'll measure from the earlobe to the corner of the mouth. Put in the OPA up backwards. Once it's in, I meet resistance. I'll turn it and put it into place. OPA is now in.
OPA is accepted.
Okay, my airway is now open, clear, and secure. I'm going to cut the shirt and bare the chest. So what do I see?
Contusions with paradoxical motion to the right side of the chest.
Okay, so we have injury to the right side of the chest with paradoxical motion, which is an indication of a flailed section. I'm going to go ahead and listen to my lung sounds on the good side first, midclavicular, and the other midclavicular. I will then listen to the mid-axillary on the unaffected side, and then listen to the mid-axillary on the affected side. And what do I have?
You find 6 breaths per minute, diminished lung sounds on the right while clear on the left.
Okay, at this point, due to the paradoxical motion, we suspect a flailed section. We're going to put him on a BVM, bag valve mask resuscitator. We're going to ventilate him at 12 breaths per minute at 15 liters per minute. Okay, my B step is now taken care of. I'm going to come down. I'm going to look up and down the body. Do I see any signs of profuse bleeding?
There is no obvious bleeding.
Okay, I'm going to check my pulses, my carotid and radial pulse.
Ready and regular.
Okay, my bilateral radial pulses.
Same as initial.
Okay, I'm going to go ahead and check areas in which I cannot see. I'm going to come check underneath the shoulder. So do I see any blood?
Blood found under the left shoulder.
Left shoulder. I will note that. Okay, I'm going to come underneath the small of the lumbar, the area of the back, check my gloves.
No blood found.
And then come underneath the legs. Do I find any blood?
No blood found.
Okay, I'm going to come up here now. I'm going to go ahead and do my skin vitals. First of all, I'm going to look at the skin. What is the skin color?
Pale.
Okay, I'm going to feel for temperature, forehead, neck, belly, check a few different areas. What's my temperature?
Cool to touch.
Okay, as I feel his skin, what's his condition?
Clammy, with cyanosis to the lips and cheeks.
Okay, at this point, my primary assessment has been completed. I'm going to determine this is a trauma patient. This will be a rapid transport and request an ALS to intercept. Okay, I'm going to, at this point, before we start our actual transport, I'm going to do a head-to-toe exam. I'm going to feel his head coming all the way down, feel in the back of his head, look behind his ears, look inside each of his ears. Do I find anything?
You find an abrasion with a hematoma above the left eye.
Okay, I'm going to come back, feel the back of his neck for any step-offs, any deformities. I'm going to check for JVD and tracheal deviation.
No deformities noted.
Okay, at this point I'll measure and put on my collar. So now my collar is now on. I'm going to come up and examine the clavicles. I'm going to re-inspect the chest once again. This time I'm going to palpate the unaffected side, the sternum, and we know that we have paradoxical motion to the right side of the chest. I'm going to come down, check the 4 quadrants of the abdomen.
Soft, non-distended.
I'm going to squeeze in and down on the pelvis.
Intact.
Okay, I'm going to check the groin area for any incontinence or bowel movements.
No incontinence noted.
Okay, I'm going to check the right leg, squeezing the thigh, the femur rather.
Intact.
The patella.
Intact.
Tib fib.
Intact.
Okay, I'm going to go over to the left leg, squeeze the left leg. Squeezing all the way down the femur.
Intact.
Check the patella.
Intact.
And the tib fib.
Intact.
All right, once I'm down at the bottom of the feet, I'm going to check pedal pulses. Since he's unresponsive, I'll do a Babinski test to check for any nerve response. and check the skin color of his feet.
He reflects this to sharp touch.
Okay, I'll come up. I'm going to examine his right arm real quick. Any deformities?
No deformities noted.
I'm going to check his left arm.
No deformities noted.
I'm going to check my distal pulses, radial pulses.
Intact.
Okay. Do a capillary refill where he's unresponsive, and then usually, as long as they're less than 2 seconds, that's good. If it's greater than 2 seconds, then we have something we got to be concerned about. At this point, I'm going to do a 3-man log roll with the person at the head in charge. First person going to put his hand on the shoulder below the hip. Second person will overlap and put his hand above the hip and above the knee. Third person will be next and go overlap to above the knee at the ankle. At the headman's count, we're going to log roll the patient towards the log roll people. So on his count, 1, 2, 3, we're going to do a log roll. As we do the log roll, we're going to check the back of the patient. Do we find any injuries to the back?
No injuries to posterior.
Okay, at this point on the headman's count, we'll log roll the patient back onto the backboard. Once he's on the backboard, he's being strapped. I'm going to go ahead and do my sample history and baseline vitals. We know our signs and symptoms based on the mechanism. Is there anyone here that can give us any information about allergies?
No.
Okay, I'm going to check the patient then, check his wrists and his ankles for any medical alert bracelets for medications and allergies. Past pertinent medical history, same thing off of the medical alert tags. We don't know the last oral intake, but we do know the event. The event was he was attacked with a baseball bat. At this point, I'm going to go ahead and do a set of vital signs. Blood pressure.
110/70.
Okay, I'm going to check his radial pulse.
110, weak and regular.
Okay, I'm going to check his respirations.
He's on a bag valve mask at 12 breaths per minute with equal rise and fall of the chest.
Okay, at this time we'll open up his eyes, check his pupils.
Pupils are pearl.
Okay, and I'm going to repeat his skin vitals, his color.
He is pale.
And temperature.
Cool to touch.
And his condition.
Clammy.
Okay, at this time we've got our sample history done. We've got our vital signs done. He's secured to the backboard. We're going to now put him on the stretcher, get him into the ambulance, and start our transport. During transport, we will reassess a head-to-toe exam, treat any secondary injuries that we may find, and then we'll also go back and reassess mental status, our ABCs, our vital signs, any interventions that we may have, may have done. And because of his condition, we'll do this every 5 minutes. Done.